We've identified a new asbestos-related disease, and we're figuring out ways to avoid it.
Her story lives on in each and every one of you.
Firefighters that have lost their lives, that have really put everything on the line.
Yeah, Dick is in fact, quite sorry that he can't be here. Something came up that prevented him from being here, just as I, at the last minute, had to miss last year's meeting. But he was going to speak with you this morning on the ethical aspects of the world of asbestos. And, his topic was one that many of us are well aware of, the undermining of science by scientists who don't have necessarily truth, scientific justice, and the right attitude about what happens with asbestos. Let's see, what's next slide? Yeah, Dick's pretty fancy. I didn't know he put both of our pictures up there. That's Dick on the right. Occasionally I get to growl at defense attorneys and others, so I think that's why I put my picture in there as well. Anyway, that's Dick Lemen. Dick and I basically started our careers in the world of asbestos pretty much about the same time, and have been working for really more than 40 years in this field. Dick had a distinguished career as deputy director and acting director at times of NIOSH, and is retired from the public health service with flag rank, and truly a distinguished and honorable scientist and gentleman. So, wait, I can prove that asbestos is harmless. Well, I don't have to tell the people in this room that we know better than that. We know that asbestos is not harmless. We also know that the arguments made about this type or this product or that product being harmless is, as that old Broadway show tune would say, it ain't necessarily so, and in fact it is not so. And why is it that we have this kind of work? So let's see. There are a number of arguments that have been put forth that chrysotile lacks biopersistence. That's a major theme that is put out there. There's only one problem when it comes to mesothelioma and the issue of biopersistence. You can point all day to the fact that there isn't asbestos in the lungs of people for a number of reasons. Chrysotile doesn't tend to hang around in the lung very much. But none of those people ever want to address the issue of what do you find in the pleura, the tissue where 90% of mesotheliomas occur. And if you do evaluation of pleural tissue, you'll find that in some series, up to 80% of all cases have nothing but chrysotile in the pleura. So to argue that chrysotile is harmless and to say, well, we don't find it in the lung, therefore it can't cause disease in the pleura, is certainly not a viable scientific argument. People look for alternate explanations for mesotheliomas. So SV40, a virus has been, simian virus 40 that was found in animals, has been sort of conjured up as an explanation and never really bought into. There are, in fact, other causes besides asbestos, though not in North America. If you lived on the Anatolian plain of Turkey, you'd be exposed to fibrous zeolites. If you lived on the slopes of Mount Etna in Sicily, you'll have exposure to fluoroedenite. Again, fibrous materials. So there are other things that will cause it, but certainly asbestos is the major cause and certainly the only recognized cause here in the United States. All right. Scientists will select the literature they want to, again, bolster their case. And hard to see this. Okay, I can't see that, but there are other issues that are there. Let's see. Oh, he's got these fancy slides. The human race, well, you can read that. This is, a quote of Rachel Carson's, the mother of sort of the environmental movement. April 22nd is coming up, Earth Day. around the world, and she certainly had a lot of influence, and we need to think about her and her philosophy as we address the issue of asbestos as well. And then we have this. At the core of all of this is ethics, ethics and morals, and how you function as a scientist, as a spokesperson, as a politician, as a worker, is all tied up with an ethical approach, and I would even argue the one at the bottom, the moral approach. One of the things that we realize, and what has ended up happening in the world of science, is that morality somehow seems to have gone away. I mean, we don't expect much of companies. Companies are in the business of making money. Nobody ever, thought that most companies had a moral aspect to them. Their role in the world, as they see it, is to make money. The problem is they make money on the backs and the lives of their workers. So if Dick was here, he'd be a lot more eloquent about this, but clearly the position that he takes and the view that he takes about ethics and morals and how science gets bastardized by people is one that those of us who look at the broad issue, who've worked in this field, who've looked at the science, people like myself who've both published and looked at, over the years, thousands and thousands of articles. You can't go out and cherry pick a handful of them and say this represents the truth. It doesn't work that way. So, applaud, but really applaud for Dick and his thoughts. I'm going to just finish up, and then I guess I have another talk of my own, which is hopefully a little better organized and presented to you. But Dick raises a very important issue. For individual families, the disease is devastating. For those of us that look at the broader picture, that come at it from public health, from preventive medicine, these broad issues of ethics and morals do weigh in on what happens in the world of asbestos. So for Dick, thank you very much.